indicators and sufficient grounds for the World Health Organization to say that the surge in COVID-19 cases in the country can be attributed to the Delta COVID-19 variant. In a media briefing on Tuesday, WHO Country Representative Dr. Rabindra Abeyas Singh says that the Delta variant is the most dominant variant in the country. The WHO cites the latest genomic sequencing conducted on 748 samples, almost 70% of which were Delta cases. He also confirms that there is now a community transmission of the Delta variant in the country. The WHO defines community transmission as clusters of unrelated COVID-19 cases or when links among infected individuals could no longer be established.
Information we have clearly shows that now already the Delta variant has emerged as the dominant variant. Are we in community transmission? Most certainly. We do know that the Delta variant spreads very fast, is more transmissible, has a shorter incubation period. And so, yes, with this kind of transmission, with these kinds of numbers, we are in community transmission with the Delta variant.
The WHO insists that the COVID-19 surge driven by the Delta variant is not unique to the Philippines, but there are key measures on how the country can address the threat of the Delta variant. First, there is a need to intensify the vaccination of the elderly and people with comorbidities, strictly implement the minimum health standards, and practice voluntary ECQ. The WHO also urges the public to avoid the 3 C's, closed spaces with poor ventilation, crowded places, and close contact settings to prevent infections. Younger people must also choose to isolate at home rather than occupy hospital beds to avoid overwhelming the healthcare system. On whether or not there is a need to double mask against the Delta variant, the WHO says proper wearing of mask is more important. There is no evidence that the use of face shields adds a layer of protection against COVID-19, but the WHO says it can help when a person is not wearing mask properly. The WHO is not recommending COVID-19 booster shots yet, citing lack of evidence and limited supply. The organization also thumbs down the proposal to place vaccinated people in a bubble. Tristan Udalo, CNN Philippines.